46-year-old female seeking facelift advice. I'm seeing the classic signs of aging: under eye bags, nasolabial folds, marionette lines, slight turkey neck. My problems are slight, but bother me enough to seriously consider surgery. I would like to know what procedures I would benefit from with long-lasting results. Would I see improvements? I want to avoid wasting time and money. By the way, I had an endoscopic forehead lift with Endotine 2 years ago, but after everything was healed, I did not see much improvement, if any.
Thank you for your question. You're 46 years old and you're stating that you're starting to notice several of the signs of facial aging, and you list them out as including under eye bags, nasolabial folds, marionette lines, and slight turkey neck. And you want to be careful about spending your money appropriately, don't want to waste your time, and you want long-term results. And you mentioned at the end of your question that you did have an endoscopic brow lift 2 years prior with Endotine, and that did not result in a satisfactory outcome. Well, I can certainly share with you my approach to helping patients like yourself. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island, and helping people improve their appearance with facial aging issues has been a core of my practice throughout this time. And certainly your type of request is something we deal with every day. So I'm going to break it down a little bit and give you some what I consider the most value options that I would typically recommend. And this is, of course, in the absence of a physical examination. So we'll start with under eye bags. This is the most straightforward. When you have under eye bags, the basic anatomy is that fat pockets that are normally around your eyes will push forward and create these bags. Now, when these fat pockets are very slight, it is possible to just camouflage them with injectables such as Restylane. However, when they become more prominent, it is consistently, ultimately, the optimal solution is a surgical procedure. And with the photos you submitted, I would probably recommend what's called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty means that I would approach the fat pockets, reduce them, and sculpt them from the inside of the eyelid. This way you maintain the natural shape of your eyes, and you are able to get rid of the fat pockets for a good long-term benefit. In fact, my patients, I will tell them routinely, again, depending on age, however, that the results can last 5 to 10 years. And when I say that, I don't mean that they'll never need eyelid surgery again. But what I'm saying is that once those particular fat pockets are gone, those fat pockets don't come back. With facial aging, there can be sagging and aging changes, but being in practice over 20 years, I have seen a lot of my patients over this time, and they'll come back to me 10, 15 years later, and they'll say, "Doc, my eyes look amazing. Now it's time for my facelift," and it does really it can really hold up. But there are factors to facial aging that can't be controlled by the surgeon. That includes physical stress, emotional stress, medical stressors. I mean, there's a lot of things that can affect the appearance of the eyes. But I think that all things being equal, if you are healthy and you take good care of yourself, transconjunctival lower eyelid blepharoplasty will most likely be of benefit. As far as nasolabial folds and mesolabial folds or marionette lines are concerned, there is a constellation of injectable fillers that can be of value to you. The balance is to use a filler that can last as long as is appropriate as possible, and at the same time is safe and is one that will actually work out well for you. Placement of fillers is an art, and I think that from my perspective, you would be a good candidate for the use of fillers such in the hyaluronic acid family, such as Restylane, such as Juvederm, and I think that you would do very well with them. Now, of course, these are not surgical procedures, these are injectables, and these require a certain amount of maintenance. And in my practice, what we do is we basically customize the procedure, and then we follow our patients and kind of learn what they tolerate and how long these materials last. Remember, you don't stop the aging process. You do continue to get older. And if there's any issue with weight gain, weight loss, etc., that can also change things. Now, as far as the turkey neck being slight is concerned, yes, at some point in your life, face and neck lifting will be probably appropriate, but we do actually have some technologies that can make some improvement to the quote turkey neck, because we're dealing not so much with skin excess, but we're dealing with volume loss in the face as well as changes in the structure of the skin and the underlying tissue. Basically, I explain to my patients that facial aging is two things. It's volume loss and descent. And for the person in their 40s, a lot of times it's more about volume loss. Now, there are ways to improve that volume and have an effect on the neck, but I think that you can look at options such as volume augmentation along the jawline and other things that might cause the neck to skin to come up into something, a technique that we use called structural volumizing. But if someone who doesn't need additional volume in those areas, we may turn to a combination of a laser technology that uses both erbium and something called ND Yag laser for soft tissue tightening at several different levels, and maybe even combine that with some platelet-rich plasma to help the skin quality. Now, this may be a lot for someone who has a slight issue, and that's part of the counseling process. We have to always define what is the desired outcome and what can we measure as true success. And so I think that at this point you're understanding one perspective, but I can promise you, you go to 10 doctors, you will get 10 different opinions. And so it is probably appropriate for you, especially considering you had not the best experience with your brow lift, that you find a doctor who has all of the skill set you need for both surgical and non-surgical procedures, and let this doctor be your specialist for the long haul. A lot of people tend to bounce from doctor to doctor looking for deals and looking for perfect solutions. They tend to be more reactive. Patients who come to me, I tend to probably attract a certain type of individual, and they tend to be more proactive. They'll say to me that, okay, we're going to take care of this problem, but you're going to be my doctor for the long haul, and we're going to take care of things as they come. And I think that's a very healthy and beneficial relationship, in that you find a doctor that you like and that you trust, and that doctor should be able to guide you appropriately and tell you what's worth it and what's not worth it. You know, a lot of times people come to me and want things that they feel are very important, and I will talk them out of it if I feel like they're not going to get the value for the amount of time and resources they're investing, and I'd rather not do something than do something and have them feel remorse for making that choice. You know, as physicians, our job is to advocate for you, and so unfortunately, a lot of my colleagues, and I'm not saying all, but a lot, tend to feel more that they will take a more passive role, and they'll say, well, if the patient wants this, this is what we've got, let's do this, and they went in with eyes wide open. But I feel like I like to take it a step further. I feel like advocacy and giving you realistic expectations and the time it takes to understand what you're getting into is my personal approach. So I hope that was helpful. I wish you the best of luck, and thank you for your question.